What is the thyroid gland?
The thyroid gland is an endocrine gland located in the neck that produces thyroid hormones T3 and T4, which help regulate metabolism.
What hormones does the thyroid gland secrete?
The thyroid gland secretes thyroid hormones triiodothyronine, T3, and thyroxine, T4.
What cells produce thyroid hormones?
Follicular cells of the thyroid gland produce thyroid hormones T3 and T4.
What is the role of TSH in thyroid function?
Thyroid-stimulating hormone, TSH, is released by the pituitary gland and stimulates the thyroid gland to produce and release T3 and T4 hormones.
How does the hypothalamic pituitary thyroid axis regulate thyroid hormone levels?
The hypothalamus releases thyrotropin-releasing hormone, TRH, which stimulates the pituitary gland to secrete TSH. TSH then stimulates the thyroid gland to produce T3 and T4. The levels of circulating T3 and T4 then provide negative feedback to the hypothalamus and pituitary to decrease TRH and TSH production.
What stimulates the release of thyroid hormones?
Thyroid-stimulating hormone, TSH, released by the anterior pituitary gland stimulates the release of thyroid hormones T3 and T4.
What is the role of thyroid hormones in the body?
Thyroid hormones help regulate metabolic rate, protein synthesis, growth and development, and help maintain body temperature, heart rate, and central nervous system function.
Which thyroid hormone is more biologically active?
Triiodothyronine, T3, is more biologically active than thyroxine, T4.
What are the steps involved in thyroid hormone synthesis?
Iodide trapping, iodination of tyrosine residues on thyroglobulin, coupling of iodotyrosenes to form T3 and T4 within the thyroid follicles, endocytosis of colloid, proteolysis of thyroglobulin to release T3 and T4.
What causes congenital hypothyroidism?
Congenital hypothyroidism can be caused by thyroid dysgenesis, defects in thyroid hormone biosynthesis such as iodine transport defects, maternal antithyroid drugs, defects in TSH or TRH receptor function, and defects in conversion of T4 to T3.
What are the clinical features of cretinism?
The clinical features of cretinism, untreated congenital hypothyroidism, include short stature, mental retardation, skeletal abnormalities, myxedema, large fontanelles, macroglossia, dry skin, hoarse cry, constipation.
What causes myxedema coma?
Myxedema coma is caused by long-standing, undiagnosed hypothyroidism, leading to severe deficiency of thyroid hormones. It can be precipitated by infection, trauma, medications, or other metabolic stresses.
How is myxedema coma treated?
Myxedema coma is a medical emergency requiring hospitalization. Treatment involves for levothyroxine, steroids, respiratory support, fluid management, and treatment of any precipitating factors. Rewarming must be done slowly.
What are the causes of hypothyroidism?
Causes include Hashimoto's thyroiditis, thyroid surgery, radioactive iodine ablation, external beam radiation, medications, lithium, amiodarone, pituitary disorders, and congenital hypothyroidism.
What are the signs and symptoms of hypothyroidism?
Symptoms include fatigue, cold intolerance, weight gain, hair loss, muscle weakness, joint pain, constipation, dry skin, depression, and slowing of mental processes. Signs include delayed reflexes, hypoventilation, bradycardia, and periorbital puffiness.
How is hypothyroidism diagnosed?
Diagnosis is made by blood tests showing high TSH and low free T4 levels. Antithyroid peroxidase antibodies can help diagnose Hashimoto's thyroiditis.
Why is the thyroid gland very vascular?
The thyroid receives a rich arterial supply to provide oxygen and iodine needed for rapid hormone production and secretion into the circulation.
Where would an enlarged retrosternal goiter project into?
As retrosternal goiters enlarge inferiorly, they project through the thoracic inlet into the anterior mediastinum, posterior to the sternum.
How is thyroid storm treated?
Thyroid storm is a medical emergency requiring aggressive treatment with beta blockers like propranolol, antithyroid medications, iodine solutions to inhibit thyroid hormone release, corticosteroids, cooling blankets, and supportive critical care.
What is the most common cause of hyperthyroidism in developed countries?
Hashimoto's thyroiditis is the most common cause of hypothyroidism in iodine-sufficient developed countries, caused by autoimmune destruction of the thyroid gland.
What genetic disorder causes metabolic defects in thyroid hormone synthesis?
Pendred syndrome is caused by mutations in the pendrin SLC26A4 gene, leading to impaired iodide transport into thyroid follicles and congenital hypothyroidism along with hearing loss.
What is the treatment for anaplastic thyroid cancer?
Anaplastic thyroid cancer has a very poor prognosis. Multimodality treatment with surgery, chemotherapy, and radiation is often given, but median survival is less than 1 year after diagnosis.
What thyroid abnormality is associated with Down syndrome?
Up to 50% of patients with Down syndrome have subclinical primary hypothyroidism caused by thyroid dysgenesis and autoimmunity. Annual thyroid function screening is recommended.
What is the most appropriate next step when a thyroid nodule biopsy is non-diagnostic?
Repeat fine needle aspiration should be performed for initially non-diagnostic cytology. If repeat FNA is non-diagnostic, molecular testing or diagnostic thyroid lobectomy are options.
What is the DAML relationship and what thyroid disease does it describe?
The DAML relationship describes the association between amenorrhea, myxedema, lymphocytic leukemia, and eosinophilia in patients with Hashimoto's thyroiditis.
How does subacute granulomatous thyroiditis typically present?
Subacute granulomatous thyroiditis usually presents with painful subacute thyroiditis, transient thyrotoxicosis, and a triphasic clinical course progressing to euthyroidism or hypothyroidism before recovering thyroid function.
What causes congenital hyperthyroidism?
Congenital hyperthyroidism is caused by transplacental passage of maternal thyroid stimulating immunoglobulins to an infant, leading to neonatal Graves' disease.
What medications commonly cause hypothyroidism?
Medications that can cause hyperthyroidism include lithium, amiodarone, interferon alpha, interleukin-2, bexarotene, and tyrosine kinase inhibitors like sunitinib and imatinib.
How does thyroid hormone regulate metabolism?
Thyroid hormone increases basal metabolic rate and oxygen consumption in tissues by increased expression of genes involved in glycolysis, lipolysis, protein synthesis, and gluconeogenesis.
What antibody is used to monitor for recurrent medullary thyroid cancer?
Serum calcitonin levels are monitored in patients with medullary thyroid cancer history to screen for recurrence, as calcitonin is secreted by the C cells that become malignant in MTC.
What thyroid disorder involves episodic unilateral painful thyroiditis?
Subacute granulomatous thyroiditis, or de Quervain's, involves episodic painful inflammation of one thyroid lobe, often preceded by viral illness. It generally resolves spontaneously over weeks to months.
Which thyroid cancers demonstrate soap bubble nuclei histologically?
Papillary thyroid carcinoma is characterized by ground glass overlapping nuclei resembling soap bubbles on histology along with nuclear grooves and intranuclear pseudoinclusions.
What causes thyroid dishormonogenesis?
Defects in key enzymes required for thyroid hormone synthesis like thyroperoxidase, dual oxidase 2, pendrin, thyroglobulin, and dehalogenases can all cause dishormonogenesis. Most cases are inherited autosomal recessive traits.
Why is TRH stimulation testing useful in evaluating hypothalamic or pituitary disorders?
After IV TRH administration, an absent TSH response indicates hypothalamic dysfunction, while a delayed blunted response indicates pituitary pathology. A normal response rules these out.
What is Sheehan syndrome?
Sheehan syndrome is postpartum hypopituitarism caused by ischemic pituitary necrosis due to severe intrapartum or postpartum hemorrhage. Central hypothyroidism results from loss of thyrotropes.
What is the most specific marker of papillary thyroid carcinoma?
The RAFV600E point mutations are found in up to 70% of papillary carcinomas, but rarely in other cancers, and serve as a specific diagnostic marker to distinguish papillary cancer from benign nodules.
What thyroid abnormality is seen in Pendred syndrome? Pendred syndrome causes a partial defect in thyroid iodide organification due to impaired iodide transport into follicles. This leads to the thyroid defect known as a positive perchlorate discharge test.
How does excess iodine consumption impact thyroid function?
Excess dietary iodine can inhibit thyroid hormone synthesis and release, referred to as the Wolff-Chaikoff effect, causing hypothyroidism. This effect is transient in normal individuals as the thyroid escapes from Wolff-Chaikoff.
What autoantibodies are characteristic of Hashimoto's thyroiditis?
Hashimoto's thyroiditis involves autoantibodies against thyroid peroxidase, TPO, and thyroglobulin proteins in the thyroid. Elevated TPO antibody titer is diagnostic.
How does amiodarone affect the thyroid?
Amiodarone can cause iodine-induced hyperthyroidism or hypothyroidism by inhibiting T4 to T3 conversion and altering thyroid hormone synthesis and release. Thyroid function should be monitored when taking amiodarone.
What thyroid disorder involves thyroid follicles with scalloped borders?
The scalloped/irregular follicles are characteristic of Hashimoto's thyroiditis and develop due to chronic inflammation and scarring of the thyroid tissue.
What is the thyroid disorder renal thyroiditis?
Renal thyroiditis is a very rare chronic fibrosing disorder characterized by a densely fibrotic, rock-hard goiter that can extend beyond the thyroid capsule to invade surrounding tissues of the neck.
What congenital syndrome involves thyroid dysgenesis along with chylomicronesia?
The Charge syndrome involves coloboma, heart defects, atresia of the choanae, retardation of growth/development, genital abnormalities, and ear abnormalities. Many cases involve thyroid dysgenesis.
What is the McRacken spoon?
A McRacken spoon is a concave deformity or scooped-out appearance of the nails seen in long-standing overt hypothyroidism due to accumulation of mucin in the nail bed.
What finding on thyroid ultrasound is suspicious for papillary thyroid cancer?
Microcalcifications within a thyroid nodule on ultrasound are suspicious for papillary thyroid carcinoma. Macrocalcifications can be seen in benign nodules.
What are the parathyroid glands?
The parathyroid glands are 4 small glands located on the posterior surface of the thyroid gland that produce parathyroid hormone, PTH, which regulates calcium levels in the blood.
How does parathyroid hormone regulate calcium levels?
PTH increases blood calcium levels by promoting osteoclast activity to release calcium from bone, increasing GI absorption of calcium, and increasing reabsorption of calcium in the kidney tubules.
What causes hyperparathyroidism?
Most cases are caused by a parathyroid adenoma, 80%. Other causes include parathyroid gland hyperplasia secondary to renal failure, multiple endocrine neoplasia, MEN syndromes, and parathyroid carcinoma.
How does hyperparathyroidism present clinically?
Hyperparathyroidism can cause hyperkaltemia, kidney stones, abdominal pain, nausea/vomiting, increased urination, bone pain, and psychiatric disturbances. Many cases are asymptomatic.
How is primary hyperparathyroidism treated?
Definitive treatment is surgical removal of the abnormal parathyroid gland. Cinacalcet can help reduce calcium levels along with 4 fluids, loop diuretics, and bisphosphonates acutely.
What is the cause of secondary hyperparathyroidism?
Secondary hyperparathyroidism occurs in response to hypocalcemia, most commonly due to chronic kidney disease reducing conversion of vitamin D to its active form.
What thyroid malignancies are most common?
Papillary thyroid carcinoma is the most common thyroid cancer, making up 80% of cases. Follicular carcinoma makes up 10%, with medullary and anaplastic carcinomas being less common.
How does a thyroid nodule present?
Thyroid nodules typically present as an asymptomatic neck mass. Large nodules can cause dysphagia, dyspnea, or hoarseness. They may be hyperfunctioning or cold on radioiodine scanning.
How is thyroid cancer staged?
The TNM system is used. T1T for classifies size and extent of tumor. N1 indicates lymph node spread. M1 is distant metastasis. Higher stages indicate more advanced disease.
What is the first-line treatment for differentiated papillary/follicular thyroid cancer?
Most cases are treated with total thyroidectomy followed by radioactive iodine, RAI, Ablation of any remaining thyroid tissue. Thyroid hormone suppression therapy follows.
How effective is RAI for treating thyroid cancer?
RAI ablation following total thyroidectomy successfully treats about 90% of differentiated thyroid cancers, with recurrence rates less than 10 to 15%.
When is external beam radiation used for thyroid cancer?
External radiation may be used for anaplastic thyroid cancers or locally advanced papillary/follicular cancers not amenable to full surgical resection. It helps improve local control.
What types of thyroid cancer have the worst prognosis?
Anaplastic and medullary thyroid carcinomas have the worst prognosis. 10-year survival is 10 to 20% for anaplastic and 40% for medullary cancer. Well-differentiated papillary/follicular cancers limited to the thyroid have excellent prognosis.
What genetic syndrome causes medullary thyroid carcinoma?
Medullary thyroid carcinoma is commonly associated with multiple endocrine neoplasia, MEN, type 2. The RET proto-oncogene causes uncontrolled growth of C cells, leading to medullary carcinoma.
How is medullary thyroid cancer treated?
Total thyroidectomy with central lymph node dissection is the mainstay of treatment. External beam radiation, chemotherapy, or tyrosine kinase inhibitors may be used in advanced cases. Calcitonin levels are used to monitor for recurrence.
What is Van Wyck-Grumbach syndrome?
Van Wyck-Grumbach syndrome consists of juvenile hypothyroidism, delayed puberty, and prolonged menstrual bleeding in girls due to an autoimmune atrophic thyroiditis. Treatment is thyroid hormone replacement.
What thyroid disorder involves episodic painless thyroid enlargement?
Subacute granulomatous thyroiditis, also known as de Quervain thyroiditis, causes painless thyroid enlargement along with fever, fatigue, and thyrotoxicosis. NSAIDs and steroids help treat the inflammatory symptoms.
How is hypothyroidism treated?
Levothyroxine is the treatment of choice and is very effective at reversing symptoms and normalizing lab values. The dose is titrated based on TSH levels.
What causes thyrotoxicosis?
Common causes are Graves' disease, toxic multinodular goiter, toxic adenoma, thyroiditis, overmedication with thyroid hormone, pituitary adenoma, struma ovarii, and metastatic thyroid cancer.
What are the signs and symptoms of thyrotoxicosis?
Symptoms include weight loss, heat intolerance, fatigue, anxiety, palpitations, and diarrhea. Signs include sinus tachycardia, widened pulse pressure, tremor, hyperreflexia, and thyroid bruit.
How do antithyroid drugs like methimazole and propylthiouracil work?
These drugs inhibit thyroid peroxidase, an enzyme required for thyroid hormone production, thereby reducing synthesis of T3 and T4.
What thyroid disorder presents with painful subacute thyroiditis followed by transient thyrotoxicosis?
Painful subacute granulomatous thyroiditis, de Quervain's, follows this course, likely due to discharge of performed thyroid hormone from damaged follicles early in the disease. Hypothyroidism can follow.
What autoantibodies are commonly elevated in Graves' disease?
Graves' disease involves autoantibodies that stimulate the TSH receptor, TSI, as well as antibodies against thyroid peroxidase, TPO, and thyroglobulin.
How is thyroid lymphoma classified and treated?
Primary thyroid lymphoma is rare, with most being diffuse large B-cell lymphoma. Treatment involves chemotherapy and external beam radiation. The role of surgery is limited.
What genetic mutation causes familial medullary thyroid cancer?
An activating mutation in the RET proto-oncogene leads to uncontrolled growth of parafollicular C cells and familial medullary thyroid carcinoma, seen in men too.
What is the Wickham survey?
The Wickham survey was a 20-year epidemiological study of thyroid disorders in the UK that provided key data on prevalence, incidence, and risk factors for hypothyroidism and autoimmune thyroid disease.
What U.S. features are suspicious in a thyroid nodule?
Suspicious ultrasound features include microcalcifications, hypochagonicity, increased nodular vascularity, irregular margins, and a tall rather than wide shape. Benign nodules are often hyperechoic.
What does thyroid peroxidase do?
Thyroid peroxidase, TPO, is an enzyme expressed on the apical surface of thyroid follicular cells that catalyzes reactions important for thyroid hormone synthesis, including iodide oxidation and iodination of tyrosines on thyroglobulin.
What causes thyrotropinoma?
Thyrotropinoma is a pituitary adenoma that autonomously secretes TSA. This leads to hyperthyroidism due to overstimulation of the thyroid. Treatment is transsphenoidal surgery with possible radiation therapy.
How does lithium cause hypothyroidism?
Lithium inhibits thyroid hormone release, leading to hypothyroidism. It also impacts thyroid autoimmunity and impairs thyroid hormone synthesis by interfering with iodine uptake.
What mutation causes resistance to thyroid hormone?
Resistance to thyroid hormone is caused by mutations in the THRB gene encoding the thyroid hormone receptor beta. This leads to variable tissue hyporesponsiveness to thyroid hormones T3 and T4.
When does postpartum thyroiditis occur and how does it present?
Postpartum thyroiditis occurs within the first year after delivery, causing painless thyroiditis, hypothyroidism, and possible subsequent hyperthyroidism. Anti-TPO antibody positivity predicts increased risk.
How does amiodarone induce hypothyroidism?
Amiodarone contains a large amount of iodine that inhibits thyroid hormone synthesis and release. It also damages thyroid cells, directly causing destructive thyroiditis in some patients, leading to transient hyperthyroidism, then hypothyroidism.
What thyroid antibody levels are evaluated in Hashimoto's thyroiditis?
Hashimoto's thyroiditis involves elevated levels of antibodies against thyroid peroxidase, TPO, and thyroglobulin proteins. Measuring TPO antibody titers assists diagnosis.
What causes congenital hypothyroidism?
Congenital hypothyroidism can be caused by thyroid dysgenesis, dysharmonogenesis including defects in iodine transport or thyroid hormone synthesis enzymes, hypothalamic/pituitary hormone deficiencies, or exposure to maternal antithyroid drugs.
What thyroid disorder involves episodic unilateral thyroid enlargement and inflammation?
Subacute granulomatous thyroiditis, de Quervain's thyroiditis, involves episodic painful inflammation and enlargement of one thyroid lobe, often preceded by viral illness. It generally resolves spontaneously over weeks to months.
What is the thyroid therapy guidelines?
The Thyroid Therapy Guidelines, published in 2012, outline an algorithmic approach to thyroid dysfunction diagnosis and treatment, including reference ranges for TSH, indications for combination T4/T3 therapy, and optimal thyroid hormone targets.
What thyroid antibody levels are evaluated in Graves' disease?
Graves' disease involves autoantibodies that stimulate the TSH receptor, TSI, as well as antibodies against thyroid peroxidase, TPO-ABS, and thyroglobulin, TG-ABS.
How does pregnancy impact thyroid physiology?
Increased estrogen causes a 50% increase in thyroxine-binding globulin, which increases total T3 and T4, but free levels are unchanged. The thyroid gland enlarges 10% in iodine-sufficient areas. GHA can stimulate the TSH receptor, causing gestational hyperthyroidism.
What is the cause of tertiary hypothyroidism?
Tertiary hypothyroidism is caused by lack of TRG production or secretion from the hypothalamus, leading to impaired T-TES production and subsequent thyroid hormone deficiency.
How does thyroid hormone impact bone metabolism?
Thyroid hormone increases osteoblast and osteoclast activity, leading to increased bone turnover and resorption. Hyperthyroidism causes increased risk of osteoporosis, while hypothyroidism slows bone turnover.
What thyroid disorder can present with painless thyroid enlargement, weight loss, anxiety, and bulging eyes?
Graves' disease is characterized by hyperthyroidism along with diffuse symmetrical thyroid enlargement, ophthalmopathy, and pretibial myxedema in some patients.
What causes toxic multinodular goiter?
Toxic multinodular goiter occurs when one or more autonomously hyperfunctioning thyroid nodules within a goiter lead to hyperthyroidism in the context of overall reduced TSH stimulation and thyroid atrophy.
How is Graves' disease differentiated from silent or apathetic thyroiditis?
Graves has autoantibodies TSI and TPO present, while silent thyroiditis does not. Graves causes diffuse symmetric thyroid enlargement, while thyroiditis causes asymmetric enlargement. Thyroiditis causes pain with swallowing or lying down.
How is thyroid storm precipitated and managed?
Thyroid storm can be precipitated by infection, trauma, surgery, or abrupt withdrawal of antithyroid meds. It is a medical emergency managed with beta blockers, antithyroid drugs, glucocorticoids, PTU, cooling blankets, and supportive critical care.
What are the indications for radioactive iodine therapy versus thyroidectomy?
Radioiodine is generally first line for Graves' disease and solitary toxic nodules if there are no contraindications. Thyroidectomy may be considered for large goiters, cold nodules, hyperparathyroidism, or where radioiodine is contraindicated.
What are the indications for thyroid surgery?
The most common indications for thyroid surgery include indeterminate or malignant cytology on biopsy, large goiters, symptomatic nodules or goiter, hyperthyroidism refractory to medical therapy, and cosmetic reasons.
What are the different types of thyroid surgery?
Total thyroidectomy involves removal of the entire thyroid gland. Lobectomy involves removing one lobe. Subtotal thyroidectomy removes most of the thyroid, leaving some posterior tissue. Near total removes all visible thyroid tissue.
What are the potential complications of thyroid surgery?
Complications include hypocalcemia due to hypoparathyroidism, recurrent laryngeal nerve injury leading to hoarseness, bleeding or hematoma, infection, and postoperative thyroid hormone abnormalities.
How is postoperative hypocalcemia managed after total thyroidectomy?
Patients should be monitored for symptomatic hypocalcemia after total thyroidectomy. Calcium and or vitamin D supplementation may be needed temporarily until the parathyroid glands recover function.
How would an injured recurrent laryngeal nerve present post-thyroidectomy?
Damage to the recurrent laryngeal nerve can cause ipsilateral vocal cord paralysis, leading to a hoarse, breathy voice. Vocal cord function should be assessed before and after surgery.
How can you avoid damage to the parathyroid glands during thyroid surgery?
Careful identification and preservation of the parathyroid glands is important. Meticulous hemostasis and avoidance of coagulation near the glands can help prevent devascularization or accidental removal.
When is drain placement indicated in thyroid surgery?
Drains are often placed with more extensive thyroid surgery to prevent fluid collection and help identify postoperative bleeding. Prophylactic drains do not prevent seromas or hematomas.
What is the recovery process like after a total thyroidectomy?
Patients experience several weeks of postoperative sore throat, neck pain, and fatigue. Voice changes are common. Activity is gradually increased over 2 to 4 weeks as incisions heal. Lifting restrictions initially apply.
How would you manage a large postoperative hematoma compromising the airway?
Large expanding hematomas require prompt surgical evacuation in the operating room with tracheal intubation or tracheostomy to secure the airway. Supportive critical care may be warranted.
How is hypoparathyroidism managed long-term after total thyroidectomy?
Chronic hypoparathyroidism may require long-term calcium and active vitamin D, calcitriol, supplementation. Regular monitoring of calcium levels is necessary to prevent complications.
What factors increase the risk of recurrent laryngeal nerve injury in thyroid surgery?
Known risk factors include reoperative surgery, extensive lymphadenectomy, large goiters, advanced stage thyroid cancer, and Graves' disease. Anatomic variations also increase risk.
How can recurrent laryngeal nerve monitoring help during thyroid surgery?
Intraoperative nerve monitoring using endotracheal surface electrodes allows assessment of vocal cord function during dissection near the nerve. This may reduce injury risk and assist identification.
What is the typical postoperative care after hemothyroidectomy?
Most patients can be discharged home the same day after hemothyroidectomy. analgesics, and monitoring/treating hypocalcemia are priorities. Activity is reduced for 1 week before gradual return to normal.
When is outpatient thyroid surgery appropriate?
Outpatient thyroidectomy can be considered for healthy patients undergoing hemothyroidectomy or total thyroidectomy without extensive lymph node dissection, provided no complications arise perioperatively.
How does thyroid storm present postoperatively?
Thyroid storm may present after surgery with hyperpyrexia, tachycardia, delirium, vomiting, diarrhea, dehydration, and hypotension from excess thyroid hormone release. Aggressive medical treatment is needed.
How is a postoperative hematoma diagnosed after thyroidectomy?
Clinical signs include acute neck swelling, pain, dysphagia, and potentially stridor. Ultrasound or neck CT confirms the diagnosis and guides needle aspiration or return to the OR.
What features increase difficulty during thyroid surgery?
Difficulty can arise from large goiters, substernal extension, extensive lymphadenopathy, invasion into surrounding structures, adhesions from prior neck surgery or radiation, and tendency to bleed.
How is hypoparathyroidism screened for prior to discharge post-thyroidectomy?
Serum calcium levels are checked after total thyroidectomy prior to discharge. Symptoms of perioral numbness and tetany should prompt repeat testing even if initial calcium is normal.
When would thyroid lobectomy be recommended over total thyroidectomy for a thyroid nodule?
Lobectomy may be appropriate for small low-risk cancers, like low-grade microcarcinomas in patients at higher surgical risk, or with comorbidities where complications should be minimized.
How is recurrent laryngeal nerve function tested intraoperatively?
Nerve monitoring uses electrodes to stimulate the vagus nerve and record signal transduction during dissection. Direct visualization assesses function at the end of surgery before closure.
What is the typical postoperative radioactive iodine treatment timeline after total thyroidectomy for differentiated thyroid cancer?
Radioactive iodine ablation is typically given 6 to 12 weeks after total thyroidectomy once TSH levels rise, to allow residual thyroid tissue uptake. Concurrent levothyroxine is withdrawn temporarily.
Hashimoto's thyroiditis involves autoantibodies directed against thyroid peroxidase, TPO, and thyroglobulin proteins within the thyroid follicles. Measuring TPO antibody titers assists diagnosis.
What thyroid disorder involves a painful tender thyroid gland and elevated inflammatory markers?
Subacute granulomatous thyroiditis causes fever, anterior neck pain, and tender thyroid enlargement along with elevated ESR and CRP reflecting inflammation.
How does amiodarone cause hyperthyroidism?
Amiodarone's high iodine content leads to iodine-induced hyperthyroidism in some patients, caused by excessive thyroid hormone synthesis and release in response to the iodine load and destructive thyroiditis.
What autoantibodies are present in Graves' disease?
Graves' disease involves thyroid-stimulating immunoglobulins, TSI, that bind and activate the TSH receptor, as well as antibodies against thyroid peroxidase, TPO, and thyroglobulin.
What is the most common cancer arising from follicular cells of the thyroid?
Papillary thyroid carcinoma is the most common form of thyroid cancer, accounting for 80% of all cases. It arises from the follicular cells of the thyroid gland.
How does thyroid hormone regulate lipolysis?
Thyroid hormone activates hormone-sensitive lipase, leading to increased lipolysis and release of free fatty acids from adipose tissue. This contributes to the catabolic effects of thyroid hormone excess.
What is the McCune-Albright syndrome?
McCune-Albright syndrome consists of polyostotic fibrous dysplasia, café-au-lait skin pigmentation, and autonomous hyperfunctioning endocrinopathies like hyperthyroidism due to activating mutations in the GNAS gene.
What does a thyroid uptake in scan assess?
A thyroid uptake in scan assesses iodine uptake efficiency and distribution within the thyroid gland. It can distinguish between hyperthyroidism, thyroiditis, and ectopic thyroid tissue versus a normal thyroid gland.
What is the Wolff-Chaikoff effect in the thyroid gland?
The Wolff-Chaikoff effect refers to the initial decrease in thyroid hormone synthesis in response to a large iodide load. It is a protective mechanism to prevent excessive thyroid hormone production in the setting of high iodine exposure.
What are the indications for thyroid surgery?
The most common indications for thyroid surgery include indeterminate or malignant cytology on biopsy, large goiters, symptomatic nodules or goiter, hyperthyroidism refractory to medical therapy, and cosmetic reasons.
What are the different types of thyroid surgery?
Total thyroidectomy involves removal of the entire thyroid gland. Lobectomy involves removing one lobe. Subtotal thyroidectomy removes most of the thyroid, leaving some posterior tissue. Near total removes all visible thyroid tissue.
What are the potential complications of thyroid surgery?
Complications include hypocalcemia due to hypoparathyroidism, recurrent laryngeal nerve injury leading to hoarseness, bleeding/hematoma, infection, and postoperative thyroid hormone abnormalities.
How is postoperative hypocalcemia managed after total thyroidectomy?
Patients should be monitored for symptomatic hypocalcemia after total thyroidectomy. Calcium and/or vitamin D supplementation may be needed temporarily until the parathyroid glands recover function.
How would an injured recurrent laryngeal nerve present post-thyroidectomy?
Damage to the recurrent laryngeal nerve can cause ipsilateral vocal cord paralysis, leading to a hoarse, breathy voice. Vocal cord function should be assessed before and after surgery.
How can you avoid damage to the parathyroid glands during thyroid surgery?
Careful identification and preservation of the parathyroid glands is important. Meticulous hemostasis and avoidance of coagulation near the glands can help prevent devascularization or accidental removal.
What finding on thyroid exam suggests anaplastic thyroid cancer?
Hard, fixed, irregular thyroid enlargement rapidly emerging in the setting of dysphagia, dyspnea. Hoarseness suggests anaplastic thyroid cancer, which typically presents with aggressive local invasion.
What factors increase the risk of recurrent laryngeal nerve injury in thyroid surgery?
Known risk factors include reoperative surgery, extensive lymphadenectomy, large goiters, advanced stage thyroid cancer, and Graves' disease. Anatomic variations also increase risk.
How is hypoparathyroidism managed long-term after total thyroidectomy?
Chronic hypoparathyroidism may require long-term calcium and active vitamin D, calcitriol, supplementation. Regular monitoring of calcium levels is necessary to prevent complications.
How would you manage a large postoperative hematoma compromising the airway?
Large expanding hematomas require prompt surgical evacuation in the operating room, with tracheal intubation or tracheostomy to secure the airway. Supportive critical care may be warranted.
What is the recovery process like after a total thyroidectomy?
Patients experience several weeks of postoperative sore throat, neck pain, and fatigue. Voice changes are common. Activity is gradually increased over 2 to 4 weeks as incisions heal. Lifting restrictions initially apply.
When is drain placement indicated in thyroid surgery?
Drains are often placed with more extensive thyroid surgery to prevent fluid collection and help identify postoperative bleeding. Prophylactic drains do not prevent seromas or hematomas.